Assalamu alaikum friends and welcome to my YouTube channel. I am Sikandar Kori. So let's start our topic. Today in this video we are going to talk about blood types and erythroblastosis fetalis. First of all, we talk about blood types. We know that there is a large number of antigens that are expressed on the surface of red blood cells, and on the basis of presence or absence of those antigens, blood is classified into groups. The most important of those groups are ABO blood group, MNS blood group system, and RH blood group system. And in this video, we talk about RH blood group system. So the antigen was first discovered from the red blood cells of rhesus monkey, and these antigens are specified by the gene R in human. So the dominant copy of the gene specify Rh antigen on the surface of red blood cells, whereas the recessive form of the gene do not specify any antigen. So the individual with Rh positive individual will have this combination of alleles to specify the Rh antigen on the surface of red blood cells, whereas Rh negative blood individuals will not show any antigen on the surface of red blood cells. And about 85% of the human population is Rh positive. The further studies shows that the Rh blood type is composed of several different antigens such as C, C, D, D, E, and E. And now we are going to talk about erythroblastosis fetalis or Rh incompatibility, also known as hemolytic disease of newborn. We will talk about each of these terms as we go through the topic. So the word hemo means blood, mainly the red blood cells. Lytic means destruction or breakdown. So this is the destruction of the blood in the fetus, mainly the red blood cells of the fetus. So due to this destruction, there is a lack of enough normal and healthy red blood cells in the circulatory system of the fetus to supply the oxygen demand, and so called anemia. So this is a type of anemia. This condition arises when a Rh negative woman marries with Rh positive man. So she will most likely to have Rh positive child. So in this case, we have Rh negative mother, and her child will be most likely be Rh positive for the red blood cells. So in this condition, hemolytic disease of the newborn occur due to the incompatibility of the Rh negative mother and Rh positive fetus, and so this condition is called Rh incompatibility. Now let's look at the mechanism. During the first pregnancy with Rh positive fetus, her first Rh positive child will be unaffected, will be normal, because the fetal and maternal blood circulatory system is separate. But during the delivery process, there is a rupture of placenta, and these Rh positive red blood cells of the fetus will enter the circulatory system of the mother, will enter maternal circulatory system, in which we have Rh negative red blood cells. So these Rh positive red blood cells will come in contact with the B cells, which will begin secreting anti-Rh antibodies in the maternal blood, which will bind to the surface of Rh positive blood, which will initiate the phagocytosis by the macrophages and neutrophils. And in this way, Rh positive blood RBCs will be cleared from the maternal circulation. These B cells will also differentiate into plasma and memory B cells. So on the subsequent second pregnancy with the Rh positive fetus, these memory B cells will become active and secrete antibodies against the Rh antigens in the maternal blood, which will cross through the placenta and enter the fetal circulatory system. So in fetal circulatory system, we have a normal Rh positive red blood cells, and these antibodies will bind to the surface of these Rh positive red blood cells and will initiate the phagocytosis in similar fashion that we saw in maternal blood circulatory system. So in fetal circulation, we see the damaged or destructed red blood cells, and along with those we also see immature nucleated red blood cells. And these immature red blood cells are known as erythroblasts. So this condition is known as erythroblastosis fetalis. After the birth of this child will experience the symptoms. Depending on the amount of antibodies involved, the child will have from mild to severe anemia, and due to the breakdown of red blood cells and absorption of the bile in the blood, the child show the symptom of jaundice, brain damage, and in more severe cases, death may occur. And to prevent the infection, prevent this condition, the Rh negative mother is given with the Rh+ injection at several points during the course of pregnancy, and this injection mainly consists of anti-Rh antibodies. And if the mother is already sensitized, the blood must be treated with plasmapheresis to prevent the antibody formation. Thank you for watching our video, and please like, share and subscribe to our channel.